name is Jennifer Grant. I will be your nurse today, performing a head to toe on you. Can you please tell me your name and date of birth? All right, and then he would tell me, and I'm going to check his wristband for his patient identifiers. All right, and then I would state that I washed my hands and I provided some privacy, such as closing a curtain. Okay, so there's no signs of distress. His color is good for his ethnicity. His breathing's good. Hygiene and grooming as well. Nutritional status, he looks healthy. And then I was asking some questions for his A&O, such as name, date of birth, why are you here, President of the United States, the date. And then I would say A&O times 3 or 4. And then I would check his vital signs, such as his blood pressure, his heart rate, his oxygen levels, his respirations, and then his pain level on a scale from 1 to 10, 10 being the worst. All right, and then now I'm going to inspect and check his head for symmetry, lesions, masses. All right, I'm going to check his scalp. I'm just going to feel gently with the fingertips of my fingers for lesions, masses, dandruff, lice, such things, which I don't. All right, now I'm going to inspect his face for color, symmetry, same thing as the scalp, lesions, masses. Okay, good. All right, now I'm going to start off by looking into his eyes and seeing if there's any abrasions, and check his eyebrows as well while I'm doing the eyeballs. So abrasions, drainage, anything abnormal. I'm going to look at the side. Okay, I don't see any scarring. Alright. Now I'm going to shine the light in his eye to check to see if his pupils are equal and reactive to light. Which they are. Now I'm going to check for accommodation by having him follow this pin toward his nose. Alright, so his pupils are equal, reactive to light, and they do accommodate. Alright, now I'm going to go to his ears, and I'm going to look for any foreign bodies, serum, anything abnormal, bruising, lesions, abrasions. Alright, now I'm going to say a 2-syllable word into his ears, such as baseball and Tuesday, and have him repeat that word back to me, so that cranial nerve is intact. Alright, now I'm going to check his nose, see if his septum's midline, check for drainage and patency. I'm going to have him lift his chin up. I'm going to look in each nair. No drainage or anything. Alright, now for patency, I'm going to have him hold one nostril and breathe out like this, and then do the same as the other nostril, which there is no drainage, and the patency is good. Alright, after that, I am going to check his mouth. I have him open his mouth. I'm going to look for missing teeth, odor, color, anything abnormal in the mouth, and then I am going to look for rise and fall of the uvula with phonation. And then for the cranial nerve 7, I'm going to have him smile, frown, puff out his cheeks, and then the cranial nerve 7 is intact. After inspecting his mouth, I am going to go to his neck and feel for any lumps. Start behind the ear, palpating, and then I would feel for the carotid artery one by one, and then see if his trachea is midline, which it is. After inspecting and palpating the neck, I would go to the chest, feel for crepitus, inspect for bruises, lesions, masses, anything abnormal. Alright, and then crepitus, you just do the tips of your fingers to feel any crackles. The crackles being the air under the skin. And then after feeling for crepitus, I would feel for his temperature on his chest with the back of my hands, such as like this. All good. Okay, while I'm up here, I'm going to test his upper strength with his neck. And I'm going to have him turn toward my hand with his face, do the other side, and then I would have him shrug his shoulders against my resistance. Perfect. All right. up. Alright, I think we're good for this upper part. I'm going to, after doing that, I'm going to auscultate his lung sounds on each side, going in a clockwise direction, one by one, and just to make sure you don't go like all over the place and it's scattered. You want to go back to back, follow each other clockwise down. And then you would do 6 on anterior, 8 on posterior on each side, and I am going to show you. Okay, so you have this, go over, down, over, down, over, and then keep going in such movement. Alright, after auscultating his lung sounds, I am going to have him lay on his back so I can go with the rest of the head to toe. Alright, I'm going to feel for his apical pulse. I'm going to start at the angle of Louis and count down 5 intercostal spaces. And then I would go over to the left intercostal space, mid-clavicular line. And then that would be the apical landmark, and feel for 60 seconds with my stethoscope. Okay, after auscultating the apical pulse for 60 seconds, now I'm going to look at his abdomen, inspect, and go on eye level just to see if there's any abnormal shapes, movements, anything like that. And then after inspecting, I will auscultate each quadrant with my stethoscope, just in the same movement as we did for auscultating the lungs, in clockwise direction. And there should be 5 to 35 bowel sounds, which there was. So he does have normal active bowel sounds. After auscultating, I would palpate. After palpating, you would percuss, but I don't think that's on his head to toe. Okay, now I'm going to check his pulses. I'm going to check his radial, his posterior tibial, which is in the back of his ankle, on the inner side of his legs, and then his dorsalis pedis, which would be right here. Alright, all are present. All pulses are present. Radial, dorsalis pedis, posterior tibial. Now I'm going to check his temperature around his skin from his shoulders to his feet with the back of my hands. And this is just checking for temperature, masses, lesions, anything abnormal, bruising, scarring, such things. Okay, after doing that, I am going to check for a cap refill on each hand and finger. Alright, cap refill should come within the 3 seconds or below. Alright, all good. Okay, I'm going to have him sit up. Have him sit up, and then I'm going to have him squeeze my fingers for his upper strength, and then have him push down on his feet for his lower strength and push up on my hands for his lower strength. Good. So upper and lower strength is intact and present. After that, I would test his gait. So I would have him stand, and I would place one hand in front and behind him and check his balance for 30 seconds. Just like this. And he would be between, and I would check for 30 seconds. And then by checking his gait, I would have him walk back and forth to see if his gait's good, he's on balance, straight, not all crazy and loopy. And yeah, I think that is all for today. Do you need anything else from me as your nurse? All right, perfect.